Prynawn da, a diolch yn fawr iawn am y gwahoddiad. I'm absolutely delighted to be here to speak to you today at what I'm sure will be a very successful and engaging conference in its new format and in such challenging times. I'd like to start by saying how impressed I am in the way that the whole sector has pulled together to respond to COVID. The Friend in Need initiative, which I'll go and talk about in a little more detail later, and the redeployment of local authority staff into care homes affected by COVID-related staff shortages are just some of the examples I can give of what the sector has done, working together to deliver better for our fellow citizens who need care and support. As we know, the measures to reduce the spread of COVID-19 have had a profound effect on our relationships and how we engage with other people. People need contact with others to feel valued, cared for, and connected. Without this human contact, loneliness and isolation can quickly lead to poor health and well-being. As well as an extra £40 million to support adult social care services during the coronavirus pandemic, we've taken action as a Welsh Government since the start of the pandemic to try and support people to stay connected with family and friends and to access the support that they might need. I was delighted we were able to provide funding of £400,000 for the Friend in Need initiative, which is being delivered on our behalf by Age Cymru. Launched earlier this year, it provides a national telephone befriending service for older people. If someone is feeling low, needs advice or support, or simply wants to chat and laugh with someone, then they can register for a free weekly friendship call with a volunteer. To help us to continue to respond, we've also set up an advisory group made up of key organisations from the statutory and the third sectors. Our discussions so far clearly show that there's been a huge amount of cooperation between the third sector and statutory services, and the speed at which organisations have adapted services as a result of the pandemic has been absolutely excellent. I'm so pleased to see the collective will to harness and learn from that good work as we move towards the next stage in the pandemic. And I want to assure you that through the advisory group and the delivery of our loneliness and isolation strategy, we will continue to work with stakeholders to focus on the most at-risk groups and promote activities that will have the greatest impact on them. We will also keep monitoring how feelings of loneliness and affected groups change as the restrictions under which we must live evolve. Personally, one of the things I found hard during the efforts to defeat this virus is the separation from my family and friends, and I'm sure it's been the same for many of you. I know it's been especially difficult for people living in care homes and for their loved ones, and I've been very moved by the correspondence I've received describing their distress and the consequences of prolonged separation. It has been absolutely heartbreaking. And I know that care home providers and their staff have worked exceptionally hard to help people maintain contact with their families and friends when routine visits have not been possible. I applaud those efforts and their innovation because they genuinely make a huge difference. Thank you, and please continue to do so because it is so important. Balancing people's rights and well-being against the desire to protect people living in care homes from the risk of infection remains very challenging. And nonetheless, visits to care homes are permitted under the regulations which have been put in place following the firebreak period. And I believe we must continue to focus our efforts and work collectively to support people to see their loved ones as safely as possible. And I'm grateful for the work of our sector stakeholder group, which includes representation from the Office of the Older People's Commissioner, the Office of the Children's Commissioner and Care Forum Wales in supporting the development of visitor guidance to care home providers. There is a clear role for both local authorities and care home providers to ensure that practical arrangements are put in place for risk-assessed safe visiting. In addition to practical measures, provider confidence is also a key factor. And I want to assure you that we are looking at a range of options to support providers, including the potential for additional visitor space through the use of modest modular units and the potential for use of rapid testing technology. As the Welsh Government, with our partners, we've used the experience of the first wave of the pandemic to identify what is required to address subsequent waves. We have set out how we are supporting the care home sector in Wales in the coming months in our Care Homes Action Plan. This plan is a component of our overarching Welsh Government Winter Protection Plan. It focuses on 6 key areas, including the well-being of people living in care homes and the people who work so hard for them. And we published an update on progress against those actions last month, and I hope you'll be able to look at that. With all this going on, I think it's absolutely vital that we don't forget our long-term aims and our aspirations for the social care system. And through working with our stakeholders, we continue to look at key subjects such as the well-being of unpaid carers. And I was proud to make 2 significant announcements on this last month as we issued our Carers National Plan for consultation. And we also launched our 1 million Carers Support Fund to help unpaid carers cope with the financial consequences of COVID. And in relation to older people, we hope to consult on our strategy for an ageing society shortly. And of course, we will continue our focus on looked after children. And I'd like to speak to you a little more about our ambitions for them now. As throughout the pandemic, children's social services have remained open, and I've been struck how quickly local authorities have adapted to the challenges of COVID. And I'm grateful for the way local authorities have continued to provide support to vulnerable children and families, taking a risk assessment approach and maintaining safe contact with children and families through socially distanced visits, remote and hybrid means. I've announced an additional 8.6 million of funding this financial year to help mitigate the impacts of COVID on children's services and on the family courts. This is designed to help divert cases away from the Child Protection Register, support family group conferencing, help relieve backlogs to the family justice system, develop a family drug and alcohol court pilot, and launch the Foster Wales brand and upskill foster carers. I recognise the additional pressures and demands COVID has placed on children's services. Local authorities continue to report increasing numbers of looked after children in Wales. We are now 18 months into our 3-year lack reduction expectation agenda. At the midway point, since March 2019, lack numbers have increased by 6.5%, out of county placements by 11.7%, and placements outside Wales by 9.6%. These numbers are stark, and there remains significant variation in the performance of local authorities between those who are able to maintain or reduce numbers and those who continue to see large increases. I'm aware that there have been fewer exits from care, which will have distorted our numbers. However, these increases are unsustainable. Reducing the numbers of children in care and supporting children to remain with their families remains a top priority, both in this Senedd term and I anticipate in the next Senedd term. Our commitment to the rights of a child to remain in the family unit, family reunification, and a change in practice, culture and leadership around restorative approaches remain as strong as ever. We must now strengthen our efforts, identify the best practice that needs to be standardised across Wales, and develop more solutions with families for the support of vulnerable children. More broadly, I'm sure we're all thinking about the future of the sector after the pandemic. There remains widespread support for the direction of legislation and cultural change set out in our co-developed social services legislation and reaffirmed in A Healthier Wales. This is the right vision for Wales. We see the fruits of this in the increasing focus on people's well-being outcomes and the collaborative work done locally, reinforced by the experience of the pandemic. At the same time, I think we need to acknowledge the complexity that exists, particularly in the adult care sector, and it has sometimes been a struggle to scale up good practice. As a sector, we must test whether our current arrangements are fit for the future. Are they the best platform for new investment? Can we reduce complexity in order to create more space for innovation? Can we improve our commissioning practice and build a more managed market focused on meeting changing needs? Can we further galvanise leadership around integration? In this regard, the crisis of this pandemic is too good an opportunity to miss. I've been in discussion, including with the WLGA and ADSS, about these matters. I'm also looking forward to further engagement with my Welsh Government Cabinet colleagues on this and to sharing some proposals with the sector in the new year. In closing, and reflecting on the fact that this is Safeguarding Week, I'd like to remind you all about the importance of the work social services do with partners to keep people safe. Please, if you've got any doubts, make the call. Diolch am wrando. Thank you very much for listening. I hope you enjoy the conference very much, and diolch yn fawr iawn.